This is concept of health education. Under the concept of health education, we discuss the definition of health and health education. Then we will consider the relationship between knowledge, attitudes, and health education. Followed by theories of evolution, as well as factors that normally improve the health of individuals, family, and the community at large. Different meaning has been given to the word health. Health can be perceived as condition of being safe. It's a state or quality of a person which enables him to perform his normal daily activities without unnecessary fatigue. Health is a situation that makes you to throw up your hands, as well as feeling good or great. So to the professionals, health means not being on sick bed. To some, it means good physical look or good appearance. However, the word health can be summarized in the following ways. 1. It is qualifying factors for living. 2. It can be defined according to WHO as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Health is more than not merely being a sick person, but there are some other factors that needs to be considered before one can be described to be healthy. So, a physically healthy person, we have sufficient vigor, strength, and good physique to carry on with his daily activities. However, normal functioning of all parts of the body contributes not only to efficiency and the ability to be effective, but it also includes being able to be cheerful, attractive, courage, and enthusiasm in life. Having described or summarized the meaning of health, let us quickly consider the meaning of health education. Health education is a systematic process of providing healthful information to the people, which eventually enhance and protect their health status. Health education is a way of disseminating healthful information to the people in order to become a well-informed person. A well-informed person will know appropriate behavior to practice, which will eventually improve its health status. Health education can also be described as the process of persuading people to accept measures which can easily improve their health and to reject those attitudes or behavior that can have adverse effects on their health. Furthermore, the roles of health education includes to convince people in the community to embrace those attitudes that can easily improve on their wellness. Health education includes providing necessary information on environmental health hazards that threaten human functions and human life. What can health educator do? Health educator perform health training needs assessment. They design and develop health education program They design and develop health education program. Health educator also publish health education materials, health information, and grant proposals. They also develop health education curriculum. Health educator can teach in both public and private schools. They also plan health promotion intervention. Well, health educator can work in the following settings. They can work at local government and state health departments, especially Ministry of Health at the state level. Health educator can work at university health centers, hospitals, and medical centers. They are better off at corporate wellness programs. Health educator can also work at federal health agencies such as disease control, insurance companies, and many other areas. Health educator can health educator must earn a degree, especially in health related areas. They can have master's or bachelor degree in public health education. The discipline should cover areas such as health education theory and practice, social policy, health issues in different populations, community diagnosis, planning management, etc. So these are some areas where health educator can be fit in. Well, the nature of health, having described health as state of complete physical, mental, and social well-being according to WHO. The nature of health includes key concepts like unity of the individual. What do I mean? An organ cannot stand on its own. It needs the cooperation of other systems in the body. I give an example. There must be blood before heart can circulate the blood to all parts of the body. Meaning that if the blood is having issue, the heart may not be able to circulate the blood as expected to all parts of the body. So health education can be seen as a quality of life. If all the body system are working perfectly, definitely one will be able to live a worthy life. So it can also be seen as achievement of personal satisfying life. So this simply means that the nature of health simply has to do with different aspects of human wellness in life. Well, concept of health education includes quality of life of a person. Quality of life of a person. What do I mean? Quality of life simply has to do with being able to live a worthy lifestyle, being able to possess a remarkable health status in life that makes you to live a worthy life. Having stamina to work, good body build as a result of physical exercise, ability to spend long periods solving a problem, all these includes on this. So quality of life is major aspects in concept of health. The health and human adaptation is another concept that is very, very important. Health fundamentally is a function of adjustment under natural conditions. An organism that survive are those that can effectively adapt to their environment. This simply means that basically man will continue to adjust to his environment and make steady advances in life. So adaptation is very, very important and is one of the major concepts of health. Others include social development, course content in related areas, health and knowledge. Knowledge is very, very important. You can only improve on your lifestyle or your attitude when you are properly informed, when you know the implication of your action. So knowledge is vital in concepts of health. So these are some of the aspects of what? Concepts of health education. Well, before one can think of effective health teaching, there are basic things that must be put into consideration. Among those things include health teaching, health education at home, in the school, and the community, as well as in public institutions. Health at home. What are the ways of handling the situation at home? Do you normally carry yourself along on the implication of some of our actions or attitudes? I give example. Sometimes after cooking the food, do you normally bother to cover it up, or do you get rid of the rodents at home? So health teaching is very, very important at home. Likewise in the school, you can only improve, you can only take note, you can only be of good observer of your health when you are properly informed. And that is why in most cases, health teaching in school does not limit to teaching of health education students alone. It also includes informal teaching. Sometimes you see the instruction, HIV is real. HIV is real. Play safe. All these are forms of informal teaching in schools. The health education in the community is also very, very important. It's also very, very important. If you take care of yourself and you fail to take care of people in your community, they can also be a source of transmission of disease to you. So meaning that this simply means that one should include health education in community setting. Community action program is also important when talking about setting for health education. Informal health teaching, as I said before, is crucial to health education. Then the use of mass media. In some cases, one may not be able to reach everywhere, but mass media can easily be used to disseminate helpful information. Personal health is also important. Personal health in most cases has to do with your hygiene, your personal hygiene. So one must also be responsible and accountable to its personal hygiene or body care. So disease and disease prevention is also important. There are some diseases that we normally refer to as infectious ones. The best thing for you is to get rid of the source or get yourself prevented from being infected by this. Then health promotion, risk reduction, holistic health, wellness, self-care, All these are vital and important in setting for health education. Well, the next aspect is aims of teaching health education. Why do we have to teach health education at all? Well, we need to teach health education in order to present and interpret scientific health data, at least for the purpose of personal guidance, as well as the community guidance. Then it also provides basic health knowledge. Teaching of health education provides basic health knowledge on how the body functions, the causes of infection, as well as methods of preventing this infection. It also helps to prevent communicable and non-communicable diseases, as well as minor health disorders. Health education helps to develop safety measures and accident prevention. It guides us against danger of self-medication. It promotes health knowledge, health attitudes, and health practice of the individual. Health education strategies and provide needed approaches which eventually help us to bridge the gap between scientific discovery and its application for everyday health purposes. Knowledge involves intellectual ability to learn and use information acquired effectively. It involves the ability to make thoughtful decisions and think critically. The pursuit and acquire of knowledge, skills, enhancement, as well as participating in health program are attributes of intellectual person. The basic truth about knowledge is that you can't offer what you don't have. So that is why it is very, very important for one to always update its health information. It must be current about issues, especially issues related to diseases, issues related to source of infection and the rest. All these are very, very important and helps one to become a well-informed person. Then your knowledge will also help you to make your wise choice on health services to patronize and the choice of health product to buy. All these will be determined by your knowledge. Person attitudes and values has their basis in cultural, social, and personal experiences. Sometimes person may not even be aware of these attitudes and its influence on his behavior. Attitudes may be described as a mental and natural state of readiness, organized through exposure, extending a directive or dynamic influence upon the individual's response to all objects and situations. So your attitudes in most cases helps either to improve on your well-being or to affect your well-being. I give an example. A medical doctor who happens to be a smoker, despite his knowledge that smoking or smokers are liable to die young, shows that despite his knowledge about the problem, he still chooses to behave negatively towards improving its health. So knowledge in most cases should be a positive one, and it can be a positive one when it improves your attitudes towards your health. Relationship between knowledge, attitudes, and health. Well, effective health education consequently improves your knowledge, attitudes, and practices, and this will eventually lead to better disease prevention and control. Health education also helps to improve your knowledge, attitudes, and practices, particularly those things that has regard to your lifestyle modification. For instance, dietary management, better healthy life, engaging in sporting activities, and the rest. Health education imparts knowledge on environment. It helps to improve on environmental sanitation, physical, social, emotional, intellectual, and spiritual health. So it is a course that cannot be toyed with. It is a course that helps to improve knowledge, attitudes, as well as your practices, which eventually lead to better prevention and disease control. Evolution. Evolution refers to the periods of development of races or species, during which series of changes do take place, and psychologically characteristics distinguish a particular species or group. Evolution of human shows that man have made great progress in developing from a lower form of life. The study of evolution shows that people should not follow a sedentary lifestyle. There are different diagrams to show the evolution of different species of animals as well as plants. Evolution, once again, is the process of change in all forms of life over generation. The process of natural selection is based on three conditions. First, every individual is supplied with hereditary material in form of genes that are received from their parents, then pass on to their offspring. Secondly, organisms tend to produce more offspring than the environment can support. Third, there are variations among offspring as a consequence of either the introduction of new genes via random changes called mutation, or reshuffling of existing genes during sexual reproduction. The last unit, as far as concept of health is concerned, is factors that are responsible for factors that influence the health of individual. Factors that influence the health of individual. And among the factors that influence the health of the individual is heredity. Heredity is generally considered as a factor that provides the raw materials for a person's future health as well as other personal attitudes. Heredity does not only determine means potentialities, but it also sets the potentiality in individuals, such as having a high level of intellectual capacity, or to its disadvantage, such as inheriting certain health problems like sickle cell disease, low intelligence, poor personality, or inadequate physical conditions. So heredity can be in two folds. It may be positive or negative, but the most important thing is whatever one inherited, one should be able to improve on it. Environment is another factor that affects the individual health. Environment consists of physical, biological, and psychological elements. Environmental elements are of tremendous importance to man's health, since most of these elements can be manipulated to the advantages or disadvantage of man. So, examples of types of environmental factors include physical, which the elements includes natural, sub-elements are air, weather, climate, soil, humidity, rain, food, shelter, clothing, chemicals, etc. Some are man-made in nature. So then the second types of environment is biological, like microorganisms, plants, insects, animals, bacteria, virus. Then the third types of environmental components is psychological in nature. An example are stress, cultural values, attitudes, moral, educational status, social organization, political organizations, etc. So apart from environment, other factors that improve human's well-being includes nutrition. Nutrition contributing to life. Most of the challenges people are having is as a result of food consumption. For instance, not having enough to eat implies undernourishment. And overeating can also lead to obesity, which may likely lead to cardiovascular diseases. Rest and sleep. Rest and sleep, this could be described as the restorer of health. During rest, the body processes are greatly reduced, giving the body the opportunity to restore energy, organs, and so on. So rest and sleep has its own importance to man, and among the importance include having vigorous health or ability to work. Then 2, organs recover from accumulated strain during rest. Heartbeat slow down, blood pressure drops, reduction in sensory and motor stimulations. All these are benefits of rest and sleep. Therefore, one should improve on his sleeping pattern in order to be healthy. Other factors include growth and development, exercise. Exercise has its own benefits, both physical, mental, and social benefits. Exercise can also help to reduce or help to manage some diseases in the body. So one should not live a sedentary lifestyle, as I have said before. So one must engage in one form of exercise or the other. So education is also another factor that helps to improve person's well-being. Education is the appropriate route through which all citizens can learn how to understand the relationship between the school and so on and so forth. Other factors include healthcare delivery system, health behavior, which can as well be referred to as lifestyle. So all these are vital to human existence in life. Thank you.